Good afternoon to all of you. My name is Rick Morticelli. I'm Director of Strategic Communications, and we thank you for joining us this special Leadership Partners meeting, the State of the Health Network Address. And let's get started because, we started something new last month. We wanted to share a special video with you at the beginning of each presentation to share the information that we've been telling our colleagues, our community, throughout the past couple of weeks, and looking ahead, what's coming up. And we call this video so no one misses it. So we encourage you to watch this information, remember it, and share it so no one misses it. So please enjoy this video. There you have it, so no one misses it. So we invite you to share all that information there, as well as the information you're going to hear today. Today, as you know, is the State of the Health Network Address, and we're excited to welcome our President and CEO, Dr. Brian Nestor. Dr. Nestor, the floor is yours.
Thanks, Rick. Thanks very much. Isn't that kind of a cool spot Rick has over there? I don't remember us designing that, but I think it's worked out pretty well.
They call it the juror's box. I'm not sure why, but that's what people have been telling me.
We should call it Rick's box. That's what we'll probably do. All right, well, hello, everybody. Great to be with you. Good afternoon. I'd say that, every year is unique and there's something different. I think we've delayed this meeting now 2 or 3 times. So my apologies for that, but it's been a year like no other, although I said that the year before and the year before and the year before, but it has been a year like no other, and we'll give you some updates in that regard. We're finally prepared to actually give you a State of the Health Network address. So welcome. Today, we will discuss important topics relevant to the state of our health network. And at the last Leadership Partners meeting, we asked for your feedback on what topics you wanted to learn about, and your response was pretty clear. You want to hear more about our intent to merge with Jefferson. Today, I'll provide an update about where we are in the merger process. I will explain how the merger will benefit the people of our community and how it will benefit you and all LVHN colleagues. We'll touch upon other topics today as well. I'll discuss what we are doing to support colleagues who comprise the largest segment of the LVHN team, our nurses. I will talk about partners in safety, our journey towards becoming a high reliability organization. I'll explain its relationship to partners in care and why it's so important for every member of our team to put safety above all else. We'll honor our Partner of the Month, as you saw previewed in SNOMI. Plus, we'll save some time at the end of this meeting to answer your questions about today's topics. Anything you want to talk about, there's nothing off bounds. Rick is tired of asking me that question. Is there anything you don't want to talk about? And I'm like, nope, whatever people want to ask questions about, we're going to answer those questions. So to begin, I'd like to address the question that's been, for me, the most asked question, and that is a question about the merger. Why? Why is LVHN merging with Jefferson, and why now? The simple answer is because the merger will result in numerous benefits for you and all the people and communities we serve. Before we discuss those benefits, I'd like to paint a picture of what healthcare in 2024 looks like so you can better understand why we must act now. So in our region, just a couple sound bites, in the region we serve, 7 out of 10 inpatient patients have Medicare, Medicaid, or are uninsured. In 2023 alone, the cost to LVHN to subsidize the care for those patients was $778 million, and it's growing. Pre-COVID, it was about $500 million. Year after year, we have had to find ways to lower our expenses just to make up the difference. And if you are I'm smiling at a bunch of people in the room that I know are very involved with the budget season. If you've been involved with the budget process, you know how incredibly hard this is, and it's getting harder every year. Working together, we've tackled this problem, we've succeeded, and we are the only organization in the state of Pennsylvania that has had a positive operating margin the last 6 years in a row. We're very, very proud of that. But boy, was it tough. Other health systems haven't fared so well and have not been successful. Right in our region, I won't name names, but you'll figure it out. One health system in our region, in our backyard, lost more than $800 million last year. Another one in our backyard is in debt $1.4 billion. Those are hits to any home budget that are not recoverable. And other large health systems that you think may be performing well are actually losing money year after year. Last week, a huge Pennsylvania health system laid off 1,000 people, more to come. The fact that we continue to achieve a positive operating margin is why we say, as an organization, we are entering into this merger from a position of strength. And we must build an organization designed to handle the pressures facing the American healthcare system. And we will, because there actually is a better way to do this. When LVHN and Jefferson join forces, we will build better health together. We will build it for the people we serve, to provide the care they deserve, and we will build it for all of you, our dedicated colleagues, to give you the work experience you deserve. First, here's an update about where we stand. Think of the merger process like a relationship. In December, LVHN and Jefferson announced we were dating, so to speak, when we signed the letter of intent to merge. And since then, the merger has been going through regulatory reviews, and we've been performing deep due diligence on each other, checking the background of that potential spouse. We cleared, amazingly, the Federal Trade Commission's review in early February, and other regulatory reviews in Pennsylvania, particularly the Pennsylvania Attorney General's office, are well underway. Due diligence, I can now tell you, is complete. Both organizations have shared information with each other to ensure both sides are okay taking the next step in the relationship. And we're glad that that is largely done, and we are close to signing what's called a definitive agreement, which guides the transaction going forward. Signing the definitive agreement is like getting engaged, using that kind of metaphor, but it does not close the deal until you're married. After we sign the definitive agreement, we will accelerate our integration planning, make plans for the wedding. Integration planning is a process to assess the current state of both organizations in key areas and design the future state for the combined organization. Integration planning involves leaders from both organizations who will work together to determine what is best for the communities we serve, as well as our colleagues and the combined organization. A physician advisory council, for example, will be established during the integration planning, and it will be comprised of an equal number of LVHN and Jefferson physicians. Equal number. We have a voice. We are hoping to close this transaction as soon as reasonably practical. At that point, the two systems will become one, married. To complete the analogy, closing is really marriage. The merger process takes time, but we still expect to close the deal sometime in the summer of 2024. and we'll keep you posted on our progress. But right now, we've made tremendous progress, about to get engaged, assuming we can get that definitive agreement under our belt. So right now, there remain no immediate changes in day-to-day operations occurring at this time. LVHN and Jefferson continue to operate as separate independent entities until the merger is complete. And even then, integrating to the degree that is most appropriate will be a process with a great deal of collaboration that will take a great deal of time. Once we close, day one will be very similar to the previous day. Clinical operations, network operations, branding, the name of our facilities, and your role and department structure all will be the same on day one. You'll have the same badge. You'll have the same supervisor. You'll work in the same location. Your pay and benefits will be the same. Even as we recognize the Jefferson affiliation, we will continue to be called Lehigh Valley Health Network. And the list of things that will remain the same goes on and on and on and on, including the fact that we will always be our community's hometown favorite health network. This will take months and really actually years to fully integrate our organizations. For now, continue doing what you do, continue to provide extraordinary care to our patients and our communities every single day. So that's where that stands. Now let's talk about the benefits of the merger, which are numerous. The benefits vary depending on who you are. Here are the benefits to the people of our community, that cohort. LVHN and Jefferson are merging to give the people we serve convenient access, more convenient access to care. There will be more than 700 locations across eastern Pennsylvania and South Jersey where people can access award-winning care they need at the right place and right time, and those access points will expand. The merger will add more specialists to your community. With Thomas Jefferson University, we'll educate the physicians, the nurses, the healthcare professionals of tomorrow, bringing more healthcare experts to hometowns across our region. The merger will give people access to an expanded, affordable health plan. The Jefferson Health Plan is designed to ensure people get the care they need when they need it, in particular, people who have Medicare, Medicaid, and federal health care exchange insurance. Remember my comments from early on. It's $776 million that we are subsidizing their care. The merger will bring more of the latest technologies and treatments to our communities. Remember, we're in a medical renaissance right now. This is the worst time to not make investments. We need to make investments right now. And we will continue to make those investments to bring more world-class care to this region in eastern Pennsylvania, LVHN's footprint. And by combining the strengths of LVHN's health institutes, Children's Hospital, and research capabilities with Jefferson's strengths in neuroscience, cancer, cardiovascular, organ transplant, and other subspecialties, people will be able to more conveniently access care that is nationally recognized for quality. These are examples of how we will build better health together. Now, let's spend time talking about how the merger will benefit you and all colleagues. First, I'm sure many of our colleagues, many of you, may be anxious or concerned about the merger. I understand that, and I understand why you may be feeling that way. Change can be challenging. However, I want you to know that the merger will benefit colleagues in many ways. Here's the first benefit to you. You will work with a health system that is positioned to be strong for the future. And that's what everyone wants in their employer, stability. We are entering this from a position of strength. We are strong. We will be even stronger and more stable, despite what curveballs are thrown at us in this healthcare economy. To further our mission, we must have financial strength. By merging, we will achieve that. Here's an example. Remember, in 2023, our cost to subsidize care for people with Medicare, Medicaid, the uninsured, remember that $778 million? By getting these people on the health plan, our health plan, and providing the care they need to live well, care that's designed for them through a health plan, we will lower the amount we have to subsidize. We'll lower that dollar amount. That means we will have greater financial strength to make more investments in you and give you an even better work experience and work environment with the technology that you deserve. Which leads me to the next point about what's in it for you as an individual. There are many benefits. One is increased innovation. The combined organization will be a top 15 not-for-profit health system in the country. This attracts opportunities for innovation in care delivery, patient engagement, and other areas earlier than we might learn about them today, creating new opportunities for growth and advancements. That's the kind of environment I'd like to practice in. I hope it's the kind of environment you'd like to practice in. Here's the third benefit to you. When we merge, Thomas Jefferson University will provide even more professional development opportunities for us. TJU will give our current clinicians exciting prospects to learn and grow. Plus, we will have an opportunity to recruit the hundreds, 450 nurses a year and others, the hundreds of healthcare professionals who receive their education from this national research university every single year. We will create a homegrown talent pipeline by educating, as I've mentioned, the physicians, nurses, health professionals of tomorrow, bringing more healthcare professionals to our community, bringing more colleagues onto our team, working shoulder to shoulder with you. That's a benefit. And that leads us to our next benefit. You'll work alongside and collaborate with amazing colleagues. By merging with an organization with a very similar mission, vision, and values, we'll grow our team, giving you opportunities to share your knowledge and expertise and to learn from new colleagues. Plus, we will leverage our own partners and caring elements to approach the merger with the intent of building relationships, looking and listening, making it personal, and creating moments. Together, we will be among the nation's best healthcare teams, 65,000 colleagues strong, 65,000. The fifth benefit to you is that you and your loved ones will have convenient access to world-class care. Everyone needs health care throughout their life. When you or a loved one needs specialized care, you will get it right here. We're not joining Jefferson to send people to Philadelphia. Very honestly, we may see more patients coming this way. Our greater financial strength will allow us to invest in leading-edge technologies and new programs and services, catching that medical renaissance wave. We intend to make those big bets. That's on top of the investments already in the works at LVHN, which will continue. Neighborhood hospitals, a new behavioral health hospital, expansion and renovation at our current hospitals, new technologies like the latest robotic surgery platforms. All of these investments will continue as planned, and there will be more that will be secure over the next 5 years. Plus, current LVHN leaders will hold leadership positions across the combined health system, which means we will have a strong voice in molding the strategy and future of the combined organization. Tapping the talent and experience of our leaders across the organization is integral to our success because, simply put, you're awesome. Our leaders are great. You are exceptional. And I think Jefferson has that kind of respect for us. While many health systems are losing money year after year, as I mentioned, LVHN achieved a positive margin 6 years in a row. That's due in large part to our leaders. You in the room, you online, and many others. You've done the hard work and you've delivered, and that is LVHN. LVHN has been successful because of you and because of our colleagues. And I'm happy to report right now that after an incredibly rough start to FY24, one of our toughest since COVID, we now have a line of sight to achieve a positive operating margin once again, at the end of this fiscal year. Remember, we started this fiscal year in July by coming in nearly $28 million below budget. By October, that deficit grew to $41 million. Meanwhile, in the background, we had always been working hard to enhance access. We made it easier for people to schedule appointments, and we made more appointments available so patients can be seen sooner. More access means better care. It also means more revenue. Things started to turn around. By January, we achieved a 3.6% operating margin, and then in February, 2% margin. In March, positive again. March, one of our toughest months, biggest hill to climb in terms of budget, 1% operating margin. Year to date, we've climbed out of that hole, and we are at a negative 0.3% operating margin, almost break even, and we have 3 months of financials still to report. Due to our positive trends and our high patient volumes, I feel we will hit that 1% operating margin, potentially even exceed it. And this is an unbelievably huge accomplishment that you should all take great pride in, especially when you consider that other regional health systems are truly struggling. We don't want them to struggle. We're all not, almost all the hospitals I refer to are not-for-profit hospitals that are in the same business we are, with the same mission. We want them to succeed. But the climate, the American climate, healthcare economics, the system we have is broken. And we cannot wait for a federal solution. We have to act, and that's why we're acting now. So I want to thank you all for your incredible work and your determination this year. We have that line of sight on a 1% operating margin. We must remember that even, however, the strongest hospitals must have a 3 to 5% operating margin to make those big bets, investments in facilities and technologies and advancements for colleagues and the community members. They need them. So continue to manage expenses and do everything possible to give people convenient access to care. That's the recipe. You're delivering it. Thank you. You're doing a great job, and the organization is benefiting. And when patients are with us, provide excellent care, which LVHN is known for. And again, thank you for all you do. The difficult challenges we worked hard to overcome this fiscal year, which we believe will get us to that 1% operating margin, is more evidence of why the LVHN-Jefferson merger is the right thing to do. Things are simply not going to get easier. They are going to get harder. It is guaranteed it will get harder. This merger will take our clinical expertise to new heights and give us even greater financial strength to succeed. That is why this is the most exciting time and opportunity, I believe, in the history of our health network. By building better health together with Jefferson, we will create exciting opportunities for you. We will help the people of our community live their healthiest life. And we will always, always be our community's hometown favorite health network. Don't read the crap in the paper. I wasn't supposed to say that, but we're the hometown hospital gang. Don't be confused. So the next time someone asks you why is LVHN merging with Jefferson, you'll have the answers, I hope. We'll make sure you have this information available to you if you want to refer back to it. But just to be sure you know how to respond, I'd like you to watch this video. So this truly is a very exciting time, and as the merger process continues, we'll certainly keep you updated. For now, it's business as usual at LVHN, which is why we're forging ahead by addressing topics today that are important to you and essential for your own, our future success. So let's move the dial a little bit and begin talking about our nurses, the backbone of our health network. The quality of our care is only as good as the quality of our nursing care. All of us know the quality of LVHN care is world-class, and that is because we have exceptional nurses. It is why we achieved magnet designation 5 consecutive times and have begun our journey to be 6 times strong in 2024. Our nurses make up about 1/3 of our workforce and have had to endure many challenges during and since the pandemic. In recognition of all you do, LVHN is committed to giving you the work experience and work environment that you deserve. Here's how we're going to do just that. First and foremost, we will fix nurse-to-patient ratios. You have my word. We will bring back travel nurses, as many as required, to alleviate pressure on our busiest units. Also, we are going to recruit. We have hired more than 320 graduate nurses so far in 2024, with a goal to hire another 150 before the end of the year. We hired 300 experienced RNs so far, with a goal to hire another 100 by December. Our initiative to recruit nurses from Puerto Rico resulted in 25 hires so far, with more than 80 currently in the process of joining our team. And our push started years ago to hire international nurses resulted in more than 300 new hires. We will work to close the gap by continuing to enhance our marketing and recruitment efforts. But we could use your help too. Refer and please encourage RNs that you know to join us. To incentivize you to do so, we offer a very generous referral bonus, and we even are giving an enhanced referral bonus for experienced nurses in our Hazleton, Schuylkill, and Pocono markets. See the full list of those roles with referral bonuses at lvhn.org/referral. Doing everything possible to ensure nurses stay on our team is equally critical. Turnover, retention. Our turnover continues to decrease, fortunately. Fiscal year to date, our turnover rate is down nearly 3% compared to last year, plus our rate is now 6% points better than the national average. We are making some progress. To continue this trend, we continue to listen to you and address your needs. Based on your feedback, we are designing flexibility into your work schedule. Effective July 1, patient care service colleagues who currently work a full-time 12-hour shift will no longer be required to work an extra shift every 4 weeks to maintain full-time benefits. We're investing nearly $3.5 million in that effort, which will hopefully address burnout and enhanced wellness for our colleagues. While the extra shift is not mandated, obviously additional shifts are available for colleagues who wish to work more hours. We're also transforming clinical practice to give you more time to do what you do best, provide direct patient care. We hired 11 virtual nurses to cover 16 units network-wide. Virtual nurses do admissions and discharges and provide patient education. Since November, virtual nurses have completed more than 2,300 admissions and discharges, totaling nearly 700 hours of work. That's 700 hours we can return back to our bedside nurses to provide direct care to our patients. We're also implementing time savers that are being discovered by nurses on our new innovation units. For example, nurses on the innovation unit at LVH Cedar Crest 6C found a more efficient way to log in and out of a workstation, a task that is done multiple times throughout a shift and is burdensome. They implemented tap and lock technology. Now, with the use of badge readers, nurses only need to sign in on the workstation one time during an entire 12-hour shift, an efficiency that adds valuable time back to the nurse's day. This technology will soon be introduced on all workstations across LVH Cedar Crest and then expand beyond that. To nurses on our innovation units and the RNs across our health network, thank you for your care, compassion, competence, courage, and commitment to the people we serve. You make LVHN great. You truly, truly do. Throughout our history, our collective commitment to quality has been another hallmark of what makes LVHN so special. Now we're embarking on a 3-year journey towards becoming a high reliability organization, HRO, that achieves quality outcomes by putting safety above all else. We will call our journey Partners in Safety. High reliability organizations, or HROs, have high levels of complexity, but maintain high levels of safety, quality, and efficiency through processes, policies, technologies, and people. Some examples of HROs include the Federal Aviation Administration's air traffic control system, nuclear power plants, NASA, and amusement parks. HROs are not perfect and errors still occur, but because of the safeguards in the HROs, errors are rare and more importantly, are often not repeated. With patients and safety, LVHN will transform into an HRO by building a stronger culture of patient and colleague safety by predictably achieving safe, high-quality outcomes. Other health systems that have successfully adopted HRO practices decreased serious safety events by 80%. I am highly confident we can achieve excellent results such as this and more by embarking on a journey to zero harm. A few weeks ago, we started our Partners in Safety journey with a kickoff event for our leaders. We participated in robust discussions about safety and heard compelling personal safety stories from guest speakers and colleagues. One speaker's story was especially powerful. Ridley Barron, a pastor from Tennessee, was our keynote speaker. He shared why every half second counts, because during that small amount of time an error could occur that impacts people's lives forever. Now we will show you a video that was a brief part of Ridley's presentation that clearly shows why one error in healthcare is one too many. Well, it is such a tragic story. One error is too many. Yet we can all relate to it because we all have families and we all work in healthcare. We thank Ridley for sharing his story with us. For 20 years, imagine this, Ridley traveled the country to speak with healthcare organizations about the importance of safety. His mission is to encourage health systems to enact change so that safety is at the forefront. Now is the perfect time for us to do just that, because Partners in Safety is an evolution of Partners in Caring. They go hand in hand. As you know, Partners in Caring is the name of our journey to transform our culture and the experience we create for colleagues, for each other, for patients and our guests. With Partners in Caring, We build relationships, look and listen, create moments, make it personal. The same elements will be an integral part of our journey to become a high reliability organization and be partners in safety. For example, when we build relationships, we create strong teams with colleagues who are accountable, encouraged to report problems, errors, and safety events. When we look and listen, we pay attention to detail and can stop, think, and act to prevent an error from occurring. These are the kind of skills we all will learn on this journey to be partners in safety. So what's next in this regard? Leaders from across our organization are learning the skills they need to support colleagues in becoming partners in safety. So leaders, if you haven't registered for training, please do so. Partners in Safety is becoming embedded within our culture. Much as I say partners in caring will never end, partners in safety will never end. It's important for you as leaders to set the tone and lead by example. It's your responsibility as a leader at LVHN. For me, learning about partners in safety and HROs was truly enlightening. I gained a much deeper understanding of the correlation between providing quality care and safe care. I learned that becoming a high reliability organization is about the consistency of performance over time and understanding how to wire the system so it's easy to do the right thing and hard to do the wrong thing. Safety. So beginning this summer, after leaders have completed their training, all colleagues will receive training, and you need to put safety above all else. We will give you the tools, I promise. Whatever you need to examine safety events, take accurate steps to ensure harm is prevented wherever possible, and we'll give you the tools to create contingency plans in the event of an unforeseen circumstance. Details about the training sessions and how to sign up will be shared with you on LVHN Insider as we get closer to starting the training. So thank you for taking this journey, for making safety the top priority for colleagues and patients, and for being a partner in safety. This journey is probably one of our most important in our entire history, and it's how we will build better health together. When you leave the meeting, I need you to help to share what you learned with the colleagues on your team. Remember, so no one misses it. Later today, leaders who are invited to leadership partner meetings will receive an email containing talking points and an FAQ, frequently asked questions, about the merger. Use these resources to have discussions and conversations with colleagues, share the latest news, and ensure that they are well informed. Encourage them to be engaged. A video of today's entire presentation and a recap will be posted on LVHN Insider next week. Please encourage colleagues to watch the video and read the recap. It's important that everyone is engaged. In addition, let's celebrate our nurses during Nurses Week and all month long. If you know a nurse, give them a hug. And if you know a nurse who's not a member of our team, tell them to get on our team, okay? Refer that person to LVHN. We'd love to have them with us. And finally, get aboard our journey of becoming partners in safety. It is what I did not know, okay? I always thought we chased the quality golden arches, if you will, and that would deliver safe outcomes. And what the research actually shows there's not a great correlation between driving high quality and safety. What's more important is by driving safety, it predictably produces quality. Do I have that right, Matt? Okay. So how does a doc who's been doing this for like close to 30 years not know that? I'm embarrassed to tell you that, but that is an important learning. That's why safety has to be our top priority. The quality will come. We already have a good infrastructure for that. Together, I think we're going to achieve this goal, and we're going to chase that zero harm status here at LVHN. So thanks for doing your part. Please share again so no one misses it. And now we'd like to spend some time answering your questions about the topics discussed today. And as you know, Rick in the box often has questions to kick it off, but we're happy to take live questions as well. So Rick,
we do have questions coming in. Before we get to questions about the topics that were addressed in your presentation, we do want to ask a question that we anticipate will come up, and that's about changes to the PTO program. So I know there are some developments going on there, and our Chief HR Officer, Ed Easterly, is here today to give us an update on things that are happening regarding changes to the PTO program. So Ed.
Hi, I'm assuming we put these here for me to hide behind. All right, so we put out a communication March regarding changes to the PTO plan. And in response to that, we received hundreds of responses, of communications from our colleagues.
They were all like applauding?
They were not. That's why I'm hiding. All right, so with the intention was not, I feel like I'm very loud, was not to detrimentally impact our colleagues. However, the timing of how that announcement went out by HR was not in the best manner for our colleagues. Considering that it would be implemented starting in July, it did not give people enough time to prepare. And then there were additional issues that were raised in the, again, hundreds of responses, not just to the posting on Insider, but colleague emails, colleague phone calls. We received them, we read them all. In response to that, we held focus groups with not only leaders, but our colleagues to understand where the pain points were. How can we listen to the issues so we can address them? That understanding continues. However, in response to the number one concern that we heard, which was this did not give us enough time to prepare, the PTO change will not be going into effect this year. There will be a 1-year delay on the implementation to the PTO change from the allotment front-loading methodology to the accrual methodology. That will give us additional time to, again, understand the concerns, make determinations of how we can modify the plan to address those issues, but no one needs to be worried that the change is going to go into effect July 1st, and I won't be able to go to my son or daughter's wedding. I won't be able to attend a planned vacation. That will not impact anybody this year. That was the number one concern that we heard, and we wanted to take steps to immediately address that. So there will be a communication going out this afternoon to all of you that says essentially what I just said, other than the hiding part, and that we will also then be putting a communication out to the rest of the colleagues, informing them of this change. And also that we continue to listen. We continue to understand that this is a concern, and we do not want our colleagues to feel like we don't care when they raise these issues. We understand, and we need to address them. So thank you. We'll go that way.
Thanks, Ed. Appreciate that very much. Dr. Nestor, we have questions coming in. The first one, when we talk about the Jefferson Health Plan, we say it's focused on Medicare, Medicaid, folks on federal healthcare exchange insurance. What does that mean exactly? Could you talk a little bit more about that? How is it focused to those individuals specifically?
So just think about, we've talked about some of this in the past, mostly through a lens of population health, because we are an integrated delivery system, ID, integrated delivery. What we don't have is the financing system, IDFS. Financing system is the insurance. We just don't have an insurance plan, okay? If you have both, that helps buffer this and helps create better pathways for managing patients, giving them the benefits that they require to stay engaged with their care and have better outcomes. Because we can write prescriptions, we can do all sorts of things and surgeries and treatments. None of it matters if the patient isn't engaged themselves, right? All right, so with that pretense, how does the merger and the health plan really benefit? Keep in mind, 20% of Americans drive 80% of the cost. You've heard me say that many times. 5% of Americans drive 50 to 60% of $4 trillion. 5% of Americans drive 50% of the cost of $4 trillion. You don't have to boil the ocean. You just have to know who they are. Well, that's easier said than done. But guess who is highly concentrated in that 5% or that 20%? People that have the social determinants of health working against them. Bad things happen in their life. Anyone can step on a cancer bomb if you have commercial insurance or Medicaid, okay? But those that are Medicaid beneficiaries, those that are Medicare beneficiaries, tend to be vulnerable populations and have greater density and opportunity to be in that 5% of Americans driving 50% of costs. So if we have the financing system, the health plan component, we can design it in a manner that if the patient is in that health plan, they get access to all the services. It's actually a front-end investment in those individuals to get them engaged. But how does the money work? Okay, so now I'll go, this gets me on a bad platform. So is Marcosi here to pull me off the stage? No, CFO. So when we go out to get a contract, right, with a managed care Medicaid plan, what's the first thing they do? They get a dollar to them from the federal government, okay, $1 of beneficiary premium dollar to take care of a Medicaid patient. What's the first thing they do? Take 15 cents off the top for their administrative fees and profit, because that's the medical loss ratio. The federal government has required that every $1 of premium at least 85 cents must be spent on clinical care, by the way, and they can play around with that 85 cents too, okay? But right off the bat, 15 cents are gone. What do you think the cost is on average to care for a Medicare patient? Is it 85 cents off a dollar? No, it's like 93 cents. Okay, so right off the bat, we get the contract that's at 85, and they're trying to actually negotiate it for be lower than that for someone who's already going to cost 90 cents. All right, you can see from the very start, we go in losing money, right? Now that's Medicaid. Medicare, a little bit better, but not great. So if you have the plan, we don't take the 15% off the top. We make sure there's enough there to care for the people well, and we reduce those overhead administrative costs down to about 5 cents off the top, 6 cents maybe. So we now have 95 or 94 cents left over to take care of that patient at a 90 cents or 93 cents, if that makes sense. Now, there's not a lot left over, but even if there's 3% left over, that's a lot of money, all right, that actually can go back into the company to care for those patients and help us achieve that 3 to 5% operating margin. Sorry for the long story, but that's basically it. If you have the health plan and you merge that with your integrated delivery system and you can get your patients into that plan, it's a self-fulfilling benefit. Hope it makes sense.
Some questions coming in about leaders and their frame of mind. We talk about how, the challenges we're experiencing, the industry is experiencing financially. So why should leaders not be concerned as we join another organization and there's talk of consolidation? Can you talk a little bit about that?
Sure. Number one, I think what I've gotten to, I actually know Jefferson for a very long period of time. My wife was faculty in the ER at Jefferson when I was at Einstein. Einstein's now part of Jefferson. So at least I have exposure and was in that market for 15 years before I came here 25 years ago. So I kind of know a good bit about the company. We also most know that the last CEO who assembled the modern day Jefferson and pulled together all the pieces of Health Partners, that health plan that is now Jefferson Health Plan, Steve Klasko was the chair of OBGYN here at Lehigh Valley Health Network. So we've known the company for a really long period of time. They've had their ups and downs, many ups and downs. But they're a name brand, fabulous place. We've gotten to know the new leaders that are there. We think that they have a very strong alignment in terms of mission, like we have here at Lehigh Valley Health Network. I can tell you those that have come to visit us, they are in awe of what LVHN does. By the way, and every time someone looks like they don't quite have the awe that they should have when they're here, we remind them that the busiest hospital license in the state of Pennsylvania is right here. In the state of Pennsylvania, right here at Cedar Crest. That kind of stuns a couple people. Right, that was in Ed Doherty pulled that snippet out, so we all repeat it all the time, every single day. I think, number one, we know the place. It's not like an unknown. Number two, the leadership we have a lot of respect for. Three, we think they think about life in the world very similarly. They are IDFS. Their current CEO is there for one reason, because it had the insurance plan, it had the integrated delivery system. That's why he came there. So we're very, very aligned on population health. We are all both bleeding edge population health organizations because that's value-based care. V equals quality divided by cost. V equals Q over C. You've heard me talk about that for years. So all that is good, right? But the reality is, so what's that mean to you though? How does that give you any comfort? I think probably the biggest thing that should give you comfort, beyond that it's a good organization and they think the right way, is we're not in the same market, all right? So even if they wanted to try and take over Lehigh Valley Health Network and this enterprise, they don't have the people to do it. They're busy running Jefferson, okay? They're not in this market. There's a space in between us, a couple counties, several counties actually. So that's why early on, for years, we will be operating pretty independently, although we will be married, pretty independently as we try and figure out what are the best economies, what are the best areas to integrate that make a lot of sense. So I really think, number one, great organization, lots of respect for LVHN. We are separated by geography. We're not really overlapping. If you were to kind of combine St. Luke's and LVHN, I would worry about my job. We're in the backyard. There's obvious efficiencies. We don't need two of this and two of this. That's not really the case here. So I think, and we definitely don't have enough providers already, and neither do they. So we both have to operate pretty independently here and be very thoughtful about those things that we integrate and make sure that it's good for the company and good for our colleagues. Hopefully that helps.
Lots of questions coming in about Jefferson's financial health. People obviously read things that say Jefferson is experiencing financial struggles of their own. Why is that not a concern for us?
Always a concern. It definitely is, but we've gotten over that concern. So, in the journey, a 10-year journey, Dr. Klasko had to assemble a Jefferson Health System, which was a merger of 6 different mergers that came into Jefferson. And everything was going well. And then we had the dinosaur extinction event of COVID hitting the earth, right? And that unmasked all sorts of, and amplified all sorts of weaknesses that all of us have. But if you weren't kind of prepared for them, like you didn't already have Epic everywhere, highly optimized, and you were in the middle of installing it, or you don't have it at many of the organizations, that's a weakness. If you don't really have your rev cycle perfect, like we have our rev cycle perfect here, you're going to have real financial problems. They were not prepared. They had spent that period of time very busy doing mergers and acquisition and probably didn't have enough of the eye on the ball in terms of managing all the pieces that eke out and deliver a 1 to 2 to 3% operating margin. So they got hit really hard in COVID, and they lost money for about 4 or 5 straight years, Ed, and they accumulated about $1 billion in debt. Now that some of that, good portion of that was offset with Affordable Care Act dollars, just like we got Affordable Care Act dollars. So they had a really rugged time. And I would tell you that we told the board about 2 years ago, actually, as we look for partners that can help us get to that IDFS, Integrated Delivery and Financing System, and we've looked at partners across the entire state, multiple adjacent states, Kaiser in California, you name it, we've looked at it, right? How do we get that darn health plan here? I had to go back and confess and say, look, with the losses they've taken, and Dr. Klasko, who I've trusted and known for 25 years, I don't think they're a good candidate. I took them off the list. It's going to take 3 to 5 years for them to turn around their financials, and it really depends on what kind of leader they bring in. And we all concluded if they bring in an academic leader, because it is an academic medical center, if they bring in an academic leader focused on the medical school and all the traditional kind of trappings that brings, they're not going to do well. And we can't anchor ourselves to that. Lo and behold, they did the exact opposite. The top 20 of the top 25 leaders, 20 of the top 25 are new within the last 18 months. That's the longest tenure of any of those people, 18 months. Many are at 6 months now. They're mature. They're at 6 months. They've been with the organization. So there was a cleaning of the house, number one. The leader is Dr. Cashone is a very seasoned, knowledgeable clinician, interventional cardiologist by background. Don't hold that against him. Sorry, Mike. But experienced, understands brand, ran the Cleveland Clinic Global Cardiac Institute, arguably the best brand in the world. He did that for 10 years. He ran one of the largest physician practices, 9,000 doctors at Ascension Health, was an EVP managing one of their markets, and ran all of their insurance products. But I believe he has his own story, but wasn't going in a direction like he saw an opportunity to take Jefferson in a different direction. And then chose to come here to Pennsylvania. So he's fairly fearless. He is single-minded in terms of getting to the future. He is driving hard on the health plan. He knows that we still are in a time of medical renaissance. We have to make big bets, and this is not a time to get shy and not make investments. One example of that is, as soon as he got there, he pushed and helped support their Sidney Kimmel Cancer Center, not just remain NCI designated, they became a comprehensive cancer institute. I mean, there's one, how many are there, Suresh, in the country? 14 or something? Comprehensive? 15. 50, I'm sorry, okay. So, elite cancer services. So I'm impressed with what they're doing. By the way, in the first year, they turned their finances around. We're supposed to lose almost a couple $100 million. They cut that down to about -70. This year, their budget is to break even, and they will. I was just with Dr. Cashone this morning. So they've turned the company around financially. And we've done, as I mentioned in my comments, we've done the due diligence. There is tremendous financial opportunity, even without us coming together, that they're working on hundreds and hundreds of millions of dollars that they're spending their time on. By the way, that's not unfamiliar to us. We've taken over $600 million out of LVHN over the last 5-6 years. All right, so, and we're about a $4.2 billion company. They're about a $6 billion capital enterprise, clinical enterprise. The hospital component is about that, a little bit bigger than us. So if we took 600, maybe there's $800 or $900 million still available for that, just to improve their own finances. And then when you bring us together, there's so much we can do in terms of just how we conduct business with vendors. I'm looking over at Brian across the way, Brian Lennick. Pharmacy alone could be well over $150 million of savings. So that's a lot when 1% operating margin here is $40 million. Okay, so that's a lot of money. So why would you be optimistic? Good organization, people think the same way, a really great leader that I personally believe in, tremendous financial integration opportunity to make us financially strong. Those are all really good reasons to be a stable, financially strong organization as we are facing a future of real uncertainty in healthcare. There are no solutions coming out of Washington. There just aren't. Things are going to crash, things are going to burn, and it is what it is, all right? We're going to be there to help other organizations around the state that are going to really struggle, but we're not going to be one of them. That's the point. So I would be optimistic if I'm a leader. This is about opportunity. It's about a great future. It's about a stronger organization so we can make investments. We can make sure our colleagues, our nurses have the environment they deserve. So I would be optimistic.
If anyone has a question here at Cedar Crest, just please raise your hand. We'll run a microphone to you, but if you do, just raise your hand. In the meantime, you addressed some of this, but it's a good question. In your presentation, you talked about how the merger benefits our organization, our colleagues, our community. What's in it for Jefferson? What are the benefits to them to merge with us?
Take a guess. If their goal is like ours, IDFS.
It's our patients.
What's that?
It's our patients, it's our community, getting more people in their health plan.
There you go. That's right. They have a plan. They're very satisfied with the plan without us. You add us, which is basically eastern Pennsylvania up to Lackawanna County, and it's an opportunity to accelerate their plan by years. So you're exactly right. Yeah. Now, not about our patients going to Philadelphia. It ain't about that. Okay, again, I think in the net, we're going to get more patients coming here because of the association, and that's a different problem, right? We have to accommodate that growth. But the health plan expansion, I think, is an obvious one. That's what started this. It was started with a managed care conversation between CFOs and then led to something else. And I think then they came and saw what LVHN is. We always loved the fact that Philadelphia thought there were more deer than people in the Lehigh Valley. We would love that because they weren't competing. You didn't see their advertisements. You're seeing their advertisements now, right? So I think they've realized that this is a pretty precious place to live, grow a family, build a career. So it's special also as a place, but the opportunity to expand the health plan is, I think, key.
Dr. Schreiber, talk about the training for leaders. Is there more training coming up for leaders for partners in safety?
I take from your question that people are anxious for more training, so far be it from me to disappoint them. Currently, we're trying to capture all leaders for universal skills training. This is the same training that all colleagues will have, but we also know that the role of leadership is particularly important, so there are leadership methods that we want every leader to be exposed to so that they can acquire these skills, and we will have an expectation that they use those new skills. So leadership methods training will be coming between now and the end of July. In addition, we know that you never know something so well as when you have to turn around and teach it to somebody else. So we are going to be facilitating ourselves all of the training to our own colleagues. So also between now and July, there'll be an opportunity for trainers to learn how to be trainers, to ensure that they really feel comfortable with the material that they'll be training. And also we provide tips, tools, and tactics about how to manage a room and how to be a compelling facilitator.
Thank you so much. Dr. Nestor, question about our affiliation with a medical school. Obviously, through the merger, we would create a relationship with Thomas Jefferson University, but why not maintain our relationship with USF?
You know, Mike's here. Mike, can you come up and maybe answer that one? I won't give it justice. So just as a reminder, what about the medical school relationship, and wouldn't it make sense to maintain our USF relationship?
Thanks. Great question. Unfortunately, the answer is no, for two reasons. Number one, it does take two to tango, and USF has made the decision that it would probably be in their best interest, given our new relationship with Jefferson, to sunset our USF Select program. We are committed, and always have been, to honor the commitments that we've made to the students that are currently enrolled. And so that will take place. But for this coming summer, there is no incoming first-year class of medical students because of that decision from USF to sunset the program. Second would be, we wouldn't have the capacity, the clinical capacity, to educate, double the cohort size. But again, that part is a moot point given where we stand with USF. So we're committed. We'll continue out the 3 remaining classes that are here, and then currently in conversations with Jefferson around what that vision looks like for the next chapter of medical education at LVHN.
Thank you. Another common question, Dr. Nestor, we've been getting since the beginning. The question, is this a merger or acquisition? And you might even see things in the paper or in the media that's saying it's not a merger. Please dispel that rumor, if you will.
Yeah, it's play on definitions and words. In not-for-profit healthcare, all right, there is no money exchanged when you bring two organizations together, right? So you merge your assets. So there's no check written to acquire something or buy something. You literally just merge the assets. That's not-for-profit world. So we are, in the not-for-profit world, very accustomed to just saying it's merger, okay? Those that like to pick at this, play games with words like acquisition, because the acquisition word implies you're the inferior, smaller, less valued entity that someone really great is coming in, is going to purchase and buy and then break it apart for parts. That's why our competitor loves to put this stuff out in the news, okay? Again, don't read it. I would have to have a subscription to read it, okay? Fortunately, I get all my news from Ed, who reads everything. So, as I have studied this, because it's just such a pain point with me, as maybe you can tell, on a technical basis, every transaction can be called an acquisition. All right, because there is always some elements of acquiring as you merge. So, by the way, by merging, our assets are folding into Jefferson. That there is one company at the end of the day, right? Jefferson. So it's a merger. For those that want to play semantics and say acquisition, I don't know what to say about it. I would ignore it.
Is there anything a colleague can do to prepare for the merger? Is there anything they should do differently as this moves forward?
I don't really think so. I mean, I wish I could just make you all feel comfortable, and that's going to be impossible. So I think the best way to manage that is after we get through this definitive agreement phase, assuming we do, okay, we believe that we will get to that phase, there'll be intense planning on integration. More more colleagues will be involved with that integration work, and we'll be at more liberty to share even more information, which I think will only make you more comfortable. Okay, we're going to have real voice. We're going to have a management voice, leadership voice, physician voice, board leadership at the very top of the organization, new organization. LVHN will be represented. We really will be. So I'm very optimistic about that. Our board would not have it any other way. Okay, so I don't do it. You don't have to prepare for it. Okay, maybe prepare and pay attention to more information, more communication coming out over the next couple of months, because we really want to make sure we keep feeding you with information so you feel more comfortable. But I would tell you, July or August, whatever it is, it's going to look very similar to today, just with greater opportunity.
Do we know what the board makeup will look like yet, or is it too soon for that?
We'd be able to share that, I think, after the definitive agreement, perhaps. I always got to look at Annette here, make sure I don't misspeak. Right now, we probably wouldn't want to talk about that, but shortly. Shortly? Shortly. Thank you.
Good question. Is Jefferson an HRO? Do we know that?
They are not.
They're not.
They are not.
Okay.
They're enamored with our work.
Let's see here. We're getting close to the end. Any questions here at Cedar Crest? Well, look, there's one back there. If we don't mind running one back there quickly.
Where do you see the LVHN name going 5, 10 years down the road?
You want to take that question? Not like you know the answer, but he'll give you a little bit more, I think, specifics than I can give you.
So we're working through all of those details right now. Our name is not changing at the beginning. We are forming a combined organization. The Lehigh Valley name is going to be here. This will be Lehigh Valley Hospital. If you look at the naming conventions over time, you see Jefferson with that name, but they respect who we are, our brand, and you're not going to see big changes in signage or anything like that in the near future.
And what example of Abington?
Abington, if you look online, you will see Jefferson Abington Hospital. You'll see Jefferson Einstein Hospital. So they've got a brand architecture where they've been able to preserve local names. And when you think about that as we talk about a Jefferson health plan, the more that we can show the connectivity, again, back to Dr. Nestor, IDFS, right? The more that we're linked together, the higher the probability of success of the total plan.
Thanks.
Thanks, Ed.
We're very familiar with the Jefferson brand here, because I think what percentage of our docs are from Jefferson? I heard 15%, 20%. 20% of our docs either went to the medical school there or had their training at Jefferson. That's a lot, okay? So we're familiar, at least medically, with Jefferson as a quality place. We've got great talented docs here, and probably nurses from Jefferson as well, and other parahealth professionals. But what's interesting is in our northern markets, say Pocono, they are probably more familiar with Jefferson than many people here in the Lehigh Valley because they had relationships with Jefferson for many, many years. So Jefferson has a brand that goes well beyond Philadelphia and out up into the northern, think Route 80 corridor. It's maybe more well-known than some in the room might think that live locally.
Any other questions here? Raise your hand, please. We got through all of them on WebEx. Okay, I think we're good. We can just continue.
We have one more, thanks for your questions. We have one more thing to conclude this morning, and that is to introduce you to our Partner of the Month for April 2024. This month's winner is Matt Yorsky of the Transitional Open Heart Unit at LVH Cedar Crest. So we'll give him a little round of applause to start. So without question, Matt is a partner in caring because he makes it personal. His story will inspire you. I got late notice that, Matt works night shifts. So Matt's not here. Hopefully Matt is sleeping. We want him, zinging tonight, so he's not here, but, he's in our thoughts here, and why don't you watch this video.
How can you make it personal with a laptop computer? My colleague Matt Yorsky shows us how. Matt cared for a man who lost part of his leg following a car accident. Understandably, the patient was worried about his future. Matt listened as he shared his concerns for adapting to a new way of life. The patient hoped to get a job that allowed him to work from home, but he didn't have money to get started. So, Matt got him a refurbished laptop and delivered it to his home.
Pretty cool. So, Matt, hopefully you heard a little bit of that little clapping going on. That was for you, Matt. We're grateful that he is our partner for caring and appreciate the round of applause for him. If you see him tonight, you're on change of shift, give him a big high five. That'd be great. So for all of you who came today or participated online, I want to thank you very much. In closing, I really appreciate all that you do. And remember this, the state of our health network is strong. We have figured things out where other organizations have not. We will have good news at the end of this fiscal year that we made money once again. We may even surprise ourselves and beat that 1% operating margin. I know I'll get hit for that one. John Pierre is glaring at me over there. You all have done a fabulous job. You should be very, very proud. So thank you all and really appreciate your time. Thank you.